So thank you very much for this opportunity, and thank to the Waldenstrom Foundation. I'm Nicolò Danesin. I'm a medical doctor. I work at the Hematology University of Padua in Italy. And what we are talking today is a poster that we shared in the last Congress in Chantilly in France. And that poster talk about our study that we performed in our center in 2024. And it is a study centered on WM patients followed in our center with aberration at chromosomes levels. So first of all, chromosomes are structures that we have in the nucleus of our cells that contains our genetic materials. And, we can have modification in chromosomes in terms of quality or in terms of numbers. So what we found in our patient, in 63 patients, is that 30 patients display abnormal karyotype, so aberrations at chromosomes levels. And those patients, when compared to patients without chromosomes aberration, display adverse disease-specific outcomes in terms of progression-free survival and also in terms of overall survival. What we found is that patients with an increasing number of cytogenetic aberration proportionally display adverse specific outcomes, despite the quality of the single cytogenetic aberrations. And another important finding that we described in this study is that patients with a more advanced age at the diagnosis time point used to have a higher complexity at chromosomes levels and used to display adverse specific outcomes too. So, for instance, patients with 3 or more cytogenetic aberrations used to display a median age at the diagnosis time point of 85 years. That is quite higher as compared to patients without chromosomal, because in this latter case, patient used to display 72 years of median age. And these findings that were described by the French group in another paper, where they characterized a higher cohort of WM patients with cytogenetic abnormalities. And they found that patients with a high complex karyotype, so with 5 or more cytogenetic aberration, and patients with the deletion of the 70q, or patients with the mutation of the gene TP53, display adverse disease-specific outcomes. To conclude, what we can say is that nowadays the panel expert recommendation does not recommend to perform karyotype analysis at diagnosis time point, but in an era where the high-risk population of WM patients is still debated, we think that this important element of karyotype assay can be another analysis that can help the clinicians to better stratify the patients, the prognosis of patients at the diagnosing time point. And thank you for your attention.